Wake up, America. It's time to talk about melatonin. What is melatonin?
Melatonin. It's a hormone.
It's a naturally occurring hormone that's made in your brain.
Most people probably think it's a gummy that sits next to their bed.
Well, actually, to what you just said, there may be some melatonin gummies.
And there's a lot of people taking melatonin, which is why we wanted to talk about it.
So what is it? It's a naturally occurring hormone. It's made in the brain in a little gland that's tucked away in the middle of the brain called the pineal gland. It's a hormone that is secreted. It helps out with our circadian rhythm, all right? And just in case you're not sure what a circadian rhythm is, circadian rhythm is actually the internal clock in your brain that helps to regulate cycles of being alert and awake and cycles of sleepiness. So being asleep, getting tired and sleeping.
Your body needs sleep.
Yes.
So it's your melatonin being released in the brain is basically getting ready for that cycle of the body needing to rest and go to bed. And so typically that happens when it gets dark. There's actually a lot of studies that show that if you go outside during the day and you look at natural light, it actually helps with your circadian rhythm because it triggers the production of melatonin later, which is really cool.
It is cool.
Our bodies and brains are like amazing.
They're amazingly intelligent, our brains and our body.
There's so many things happening in the body every day
goodness.
that we have no idea about. And it's just happening on its own because of this beautiful thing that we have.
Exactly. And I do remember once going for acupuncture. This was a few years ago. I was doing some acupuncture, and I remember the therapist who was doing it saying, look, it's really important, like what Tina just said, to get that first morning light from the sun, not from artificial light, because we were talking about the fact that I was going and exercising at the gym like at 5 a.m. Basically, the first light I was being exposed to was this artificial light. He said, your body knows. Your body absolutely knows. And so if you can try to figure out a change in your schedule where what you're being exposed to first thing is actually the sunlight, it's going to make a huge difference in your circadian rhythm. So our bodies are so super intelligent.
Yeah, and your body's supposed to make melatonin naturally. But some people struggle with sleep. There's a lot of people who struggle with sleep for all different reasons. I think, we have a lot of neurologists in the family and they do a lot of sleep study type work. And there's hundreds of sleep disorders out there, literally hundreds of sleep disorders that cause people not to sleep well. So there's a lot of people taking melatonin, and we've had a lot of patients ask, is it safe to take melatonin on an ongoing basis?
It is a naturally occurring hormone. I mean, I think it's awesome that they've been able to isolate it and be able to put it in different forms that we can take. There's all sorts of forms, tablets, capsules, liquid, gummy bears, powders. So there's all sorts of different forms in which you can take it. So it is a hormone that as we age decreases in the production. So our body doesn't continue to make it in the same doses like when you're a young child. However, as we do get older, life happens, right? So people start having problems with sleeping, not necessarily only because maybe they're not making enough melatonin, but all sorts of stuff, stress in our life. People that are up late at night on their phones, so they're getting stimulated, or watching TV late at night, and you're watching some suspenseful show and now you go to bed and that's all you're thinking about.
There's a lot of people who work night jobs.
Absolutely.
Right? And
absolutely.
I know I've done consults with a lot of people who work through the night, and it really does throw off their rhythm. They have to come home and have the blackout shades, really because you're tricking your body, right? Because the body really knows, right? We're just talking about how smart the body is. The body knows when it should sleep. And then when you have a night job, it does throw the body off. And even if you fake the body still knows it's being faked out, right? And so I've actually done some consults with patients who've realized that maybe I need to switch my job because I want to be well, right?
Yeah. So melatonin as a supplement in general is considered safe. There are, like Tina and I just mentioned, there are a lot of forms of it out there. I think one of the biggest things that we saw out there with all the different, tablets and even dissolvable, easy to dissolve tablets that you can put in your mouth and they melt basically capsules, was that a lot of what we were looking at out there have other additives and other
a lot of
fillers. Yeah.
A lot of times when patients are taking a lot of supplements, I try to encourage them to switch to liquid form of their supplements because they're just cleaner. They tend to be cleaner. They don't have as many fillers or junk in them, and we're trying to keep the body as clean as possible, right? So if you know you need to take some type of vitamin or mineral supplement, it's always good to consider liquid form. But even for melatonin, the liquid forms had a lot of junk.
A lot of natural flavorings and other preservative type fillers, additives. You know, the thing is that if you're taking a natural supplement to help you with something, the last thing that you need are those fillers and those additives. Those of you that have been following us for a long time, you know that our supplements are very clean, no additives. So that's really important because you don't want to now be not only adding melatonin, but now a bunch of other chemicals that you absolutely do not need. And now your body is busy trying to get rid of those extra chemicals. Your body already works hard to get rid of chemicals and to detox every day. And so the last thing you need are extra chemicals. Is it safe for someone to be taking the melatonin? You know, Tina and I did a lot of research on it. For the most part, it appears to be safe to take it for a short term, like 2-3 months. It's something that as far as dosing of it goes, you know, what we were able to find is that anywhere from 0.5 milligrams to 5 milligrams is considered a pretty safe dose to be taking. They were also mentioning higher doses, 10, 20 milligrams, but over and over what we saw was trying to keep it between 0.5 and 5 milligrams as far as the dose that you take.
And that when you take it, depending on how much you take and how your size too will determine how long the melatonin stays in the body.
Yep.
Typically the melatonin is only going to stay in your body for a few hours. The idea is it stays in your body while you're sleeping, right? It's going to help you sleep. You want to try to take it half an hour to an hour before you go to bed. You want to make sure you take it on a night where you know you're going to get good sleep. Like you know you're going to be able to sleep at least 6 hours. Because if you're like, oh, I'm going to take it before I'm going to need to wake up in 3 hours to get on an airplane, that's not good because your body's going to still be wanting to sleep while you have to wake up. So it's important to make sure you get good sleep when you do take it.
Right. Well, and that takes us into what are some of the side effects of the melatonin. I mean, one of them being excessive sleepiness. To the point of what Tina was saying, you want to make sure that you're going to get a good number of hours of sleep. If you end up taking melatonin and it's 1 o'clock in the morning or midnight, you can pretty much bet that you're going to probably be sleepy
into
the workday. So you definitely don't want to be taking it that late. And excessive drowsiness and sleepiness, throwing in that little caveat, if you do have that excessive drowsiness and sleepiness, you do not want to be driving or using any sort of machinery, okay? Those were some of the other things we saw as far as side effects: dizziness, nausea, some stomach ache, headache.
Those are the common ones.
Dry mouth, another one. But yeah, those are the main ones that we saw.
And again, trying to not take it for longer than 2 to 3 months at a time, trying to take a break from it. There are a lot of people out there taking it every single night, which I think could cause, more serious symptoms, like some of the other less common symptoms, but I do want to mention them because if you are experiencing these symptoms and maybe you're not relating them to the melatonin, it absolutely could be. Vivid dreams or nightmares is one of them. Short-term feelings of depression, irritability, diarrhea, constipation, so that comes on our side of stuff. Decreased appetite, urinary incontinence, increased risk of falls, increased risk of seizures, confusion or disorientation, mood swings, and reduced alertness are all kind of side effects, maybe not as common, but they could happen because of melatonin use, especially long-term melatonin use. So if you're experiencing any of those things, it absolutely could be the melatonin. So try to come off the melatonin and see if things get better.
If you are staying up late on your phone, I mean, things that are going to help enhance your sleep is number one, staying off your phone right before you're going to go to bed. Okay. It is very stimulating. And especially if you're getting on social media, and you end up seeing a post from Aunt Mary, about they had a family get together and you didn't get invited. I'm just saying that there are things that could get you revved up as far as your emotions go. And so, just trying to cut down on things that are going to rev up your emotions, that are going to be stimulating. So staying off the phone, maybe not watching psycho thriller right before you go to bed. Making sure that you're sleeping in a nice, cool, dark, maybe read a book and right before you go to bed, something that'll help to relax you. You know, these are just things. I mean, because if you're going to take the melatonin and keep watching your psycho thriller movies late at night and keep scrolling through you're defeating the whole purpose. Yeah. And, you know, and obviously if there's other things like, you know, anxiety, depression, other things that need to be evaluated by a medical professional, you know, then get help. Okay. And so anyways, I think that pretty much about covers it for our talk on melatonin. If you want to connect with us, and we invite you to please connect with us, we would love to hear from you. You can go to our website, drlizcruz.com. There's a magenta colored button on the homepage that you can click and schedule a free 30-minute wellness consult. You can do that from anywhere in the world because it's done over the phone and it is free to you. That's our gift to you. And lastly, if you have not subscribed, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.